Welcome back to Daytime here on Rogers TV. Well, every time we learn how many ways that naturopathic medicine can help you. And can you imagine that it also can help fertility? And we're here. Join, good to see you. Wonderful to see you on Saturday as well.
Yeah,
Thank you so much for coming.
Yeah, it was
we really
fabulous.
appreciate it.
Yeah.
So this is really interesting, Joelle. When we both read the notes last night to find out, I had no idea that fertility was also one of the many things that naturopathic medicine can help with.
Yes.
First of all, what's happening with fertility rates and why is it happening?
Well, right now, approximately 1 out of 8 couples is experiencing some type of fertility challenge. And a part of the reason why that's happening is if we look at what's happening in the global picture of the environment, the average age of women is now around 32 versus 20 to 24 a couple of decades ago.
Wow.
So if we actually, look at our little prop here and look at the fact that these are the female eggs, and this is what we started out with a couple of decades ago. And if we actually think about where are we right now, for females, that's where we are, because as you age, the less viable eggs that you have available to become fertile. So if you wait until you're 32, 35, you have less eggs, right?
What if you're higher than 35? How many eggs do we got?
Let's just try that, TL. There you go. Well, age is one factor, but I guess there's environmental factors as well, right?
Exactly.
What are some of those environmental factors?
Well, the biggest thing is high levels of estrogen. And estrogen is around in our environment. It's present in plastics. It's present in animal products that we consume. They're given to the animals to increase their production, etc.
Right.
So all that being said, if we look at the female cycle, there is the beginning phase, which is the first 14 days, the follicular, and that's based on estrogen. The second phase is the luteal. The most common problem we have for females is a shortened luteal phase, which means we don't have as much progesterone and we have too much estrogen coming from all these exogenous sources. So in order for us to actually become pregnant, we need to have at least 10 days of a luteal phase. So from the point of ovulation to the point of your period, you need to have 14 days. And a lot of women with fertility issues, it's really short.
How do women protect themselves then from all these outside sources that are affecting their bodies?
That's great. So we start looking at where do we get estrogen. So first of all, we go organic in our meat products. We reduce the amount of meats and animal products that we consume. We increase the amount of greens, which increases antioxidants. And then, again, we don't want to forget about males because these hormones also impact males. And these hormones tend to reduce testosterone levels, which affect, our sperm, our male guys here. We forgot about those guys. If we compare where males started, when your fathers were born, and then we actually compare where males' sperm is right now, it's about, well, half. Let's add a few more.
I was going to say it's you guys.
But if you think about the fact that it's not just females, but it's the female-male ratio, you're starting kind of with half the cup with both counterparts.
Okay, so already it's a disadvantage. Okay, if there are people out there that already know that they have a problem or maybe want to prevent, what are the natural ways that people can help out?
Well, I think the strongest thing is acupuncture. Acupuncture has been really well researched and can increase fertility by up to 27%, and that's both the male and the female side. Secondarily, for females and males, detoxification. So again, if our bodies are holding these estrogens, we have to get rid of them in some way or form. So we want to do the right kind of detox.
So what would be the right kind of detox in this situation?
Well, more than likely a liver detox. What we do at OptiHealth is we do a urine test and we find out what kind of detox do you need to do and for how long. But more than likely a liver detox would be ideal, and if at all possible, to start the fertility process up to a year in advance.
I didn't know. So liver detoxes can help manage your estrogen levels and hormone levels?
Yes, because the liver is responsible to conjugate and break down your hormones. Cholesterol is the backbone to all hormones. And so the liver goes through this cycle to break things down and reconjugate and recycle.
Huh.
Yeah. Yeah.
Oh, interesting.
No, every time you come on, you do surprise us because
definitely.
I think people, when they think fertility, their immediate thought is need to go to the fertility clinic, need to get on some type of prescription drug.
Exactly.
So are there other treatments out there that can help our bodies?
Fertility treatment is absolutely wonderful. It's a very big investment, and what we would like to suggest is that people look at these natural options, which are simple techniques, which can create results within 8 to 12 weeks. You know, when people start getting onto this process.
Could you use the two together like companions?
Definitely, yes.
Yeah?
That's ultimately our next best option, is that if somebody needs to go through the fertility program, that we're doing our acupuncture, our detoxing, all those other things with it.
What about vitamins?
Yes, for vitamins, yes, that's very helpful because that helps to increase your antioxidant capacity. It helps to increase other nutrients. If we go back to the male-female ratio, an interesting point is to promote males. So if you want to, go more blue, we really want to promote sodium and potassium because that's what the Y sperm is attracted to.
Really?
Yeah. And for females, we want to promote calcium and magnesium. So the diet changes just slightly if you have a stronger desire to potentially...
So you're saying you can naturally influence perhaps the sex of your child?
Yep. There's a technique called the Shettles method, and that research has indicated that it can be up to 75% accurate. So.
And are there other things other than just the magnesium or the sodium?
Yep. So it's also timing. If you're more interested in having a male, the male sperm are faster swimmers, but they're not as strong. So
Why is she looking at me when she says that?
So ideally what you want to do is for males, you want to try and conceive closer to ovulation.
Okay.
For females, the females are strong, or pardon me, they're slower swimming, but they last longer. So what you want to do is you want to try and conceive up to 5 days before ovulation.
Okay.
So there's that technique, there's the timing, there's alkalinity and acidity. For females, there's a higher attraction rate to an acidic environment versus males, an alkaline environment.
Typical, the females crave the junk food, right? Honestly, that's basically what it is. It starts from conception. We just have to get used to it.
See, now you can accept it, right?
Well, listen, Doc, always a pleasure to have you. And we always learn so much, like Derek was saying earlier. It's really wonderful. Thank you very much. Remember, you can contact Dr. Joelle and ask all your questions. Visit the Opta Health for an appointment at optahealth.ca. Wealth of knowledge. We're going to take a break here in a moment. Right, break.